Hello everyone. Our today lecture is going to be about ginseng roots for PharmD third semester students presented by me, Dr. Shayma Abdelgawad, lecturer of Pharmacognosy Faculty Pharmacy, Fayoum University in Egypt. Ginseng roots is a very important medicinal root that have been widely used for thousands of years in traditional Chinese medicine to improve overall health and already available nowadays in Egyptian and worldwide market as over-the-counter or OTC herbal supplement to boost energy and to reduce stress, and is one of the most famous marketed herbal supplement for the sexual dysfunctions in both male and women. It's known as Radix ginseng in Latin or ginseng roots in English, or known in Arabic as al ginseng. In this presentation, I will discuss the following topics with you: botanical and geographical origin, morphology and microscopy, active constituents, chemical test for identification of those constituents, uses, dosage, side effects, contraindications, drug interactions, and products available in the Egyptian and worldwide market of ginseng root. The botanical origin. Ginseng consisted of the dried roots and rhizomes of Panax ginseng, known as the Korean ginseng, Panax japonicus, known as Japanese ginseng, Panax pseudoginseng, known as Himalayan ginseng, or Panax quinquefolius, known as the American ginseng, Panax trifolius, known as the dwarf ginseng, or Panax vietnamensis, known as Vietnamese ginseng. It belonged to family Araliaceae. The botanical name Panax came from the Greek word panica, which means the cure all, because it's used to cure all ailment in the traditional Chinese medicine. Also, a Chinese name for ginseng was Renshen, which means man root. This name comes from its shape because it resembles the trunk of the human, resembles the body of the human. It has a trunk, arms, neck, and also legs, so it resembles the human body in its shape, and so on came the name manroot. The most expensive ginseng is derived from the Korean root aged from 3 to 6 years. Actually, when you look for the ginseng supplements available in the herbal market, you can notice on its pamphlet it's white or red ginseng. So here I will illustrate what is the main difference between white and red ginseng. It's already the same plant or the same species from the Korean ginseng, but only the difference in the method of drying of these roots. You can see here in the white ginseng, it's dried immediately after harvesting. But in the red ginseng, the roots are steamed at first, then artificial drying, and then sun drying. It contains a large amount of sugars, as we will see later in the section of active constituents. So when the roots are steamed, the sugar inside were caramelized, giving it the rich brown color, as we can see in the species named as red ginseng. So the only difference between the white ginseng and the red ginseng is the method of drying, which resulted in caramelized sugar and reddish brown color in the red ginseng, but other constituents are the same in both. Also, we use the ginseng root without decortication. We don't need to remove the cork cells. Why? Scraping the root before drying is disadvantage because the active saponins are located in the cork. So there is no need to remove the cork, and if it is removed, the active constituent percentage will be decreased. Geographical origin. As all of us we know is that ginseng root is native to the South Asia region. It's mainly found in China, Korea, Japan, and also in Russia, Canada, and India. American ginseng is less potent than the Asian variety, worldwide well-formed roots are the most valued. Now we will discuss the morphological features of ginseng roots. And here in this presentation I am focusing on the Panax ginseng or the Korean ginseng. The shape of the rhizome or root is subcylindrical or spindle-shaped. The body of the root is thickened, almost cylindrical with distinct annulation at the top. The neck is short with several stem scars. This is for the rhizome. The outer surface is longitudinally wrinkled, showing root scars. The texture, it's fleshy when fresh and brittle when dry. And also when it's dried and we try to poke it, it show short mealy fracture. The color, it is yellowish white, for example in American and Chinese ginseng, or yellowish brown or red. It's in red ginseng or the Korean species. It has a slightly aromatic odor and sweetish, pungent, mucilaginous, and slightly bitter taste. Internally, it's pale yellow to yellowish brown, exhibiting a broad soft whitish bark, as you can see here on this picture. This is the outer whitish bark, and dark brown cambium line separating the cortex from the stele region. Numerous oil and resin canals are scattered through the bark and wood, which in all the roots have a brownish red resinous content, so that in the fracture we said it's resinous due to the presence of oil and resin canal. Microscopic feature. This is a TS diagram of ginseng root, and this is a real TS section photo. It shows several layers usually present in any subterranean root or subterranean stem, such as cork, regularly arranged cells. Also the cortex layer of slightly thickened walls, showing the presence of calcium oxalate cluster crystals and starch granules. The phloem showing a secretory duct which contain the oil and resin active constituent. The xylem vessels present is reticulate and lignified. Starch granules present in white ginseng, which is unprocessed, but usually it becomes gelatinized in the red ginseng due to steaming or use of heat before drying. This is the photo of some element appeared when ginseng powder is microscopically investigated. For example, you can see here the cork cells, the calcium oxalate cluster crystals, the starch granules, and this is the wide reticulate xylem vessels, as well as the phloem with secretory duct or secretory canals containing the resin secretions. The active constituents. The most important active constituent present in ginseng and responsible for most of its biological activities is the saponins. It has both type of saponins, the triterpenoid and steroidal saponins. Saponins termed as ginsenoside by Japanese workers or panaxosides by the Russian workers. It has been too time for scientists to work on the isolation of different type of saponins from ginseng, and around 30 ginsenosides were separated. The most important compounds or major compounds were named as RG1, RC, RD, RP1 and RP2, and also a different series of panaxoside were isolated and identified by Russian scientists named as panaxoside A, B, C, and so on. The root should contain at least 1.5% ginsenoside, usually calculated as ginsenoside RG1. The saponins are of Damarian type tetracyclic triterpene. It's a mixture of both steroidal and pentacyclic triterpenoidal saponin. Upon hydrolysis, panaxosides or ginsenoside result in the aglycone moieties, which may be oleanolic acid or its derivatives such as this one aglycone, panaxidiol or panaxitriol. This is a steroidal aglycone moiety, like here This is a banaxidiol moiety which contain two OH groups, so called banaxidiol. Di mean 2 hydroxyl group, or banaxitriol. It's also steroidal glycone moiety which contain 3 hydroxyl groups like this. This is 1, 2, 3, and also here 1, 2, 3. So these are two examples of banaxitriol glycone or banaxidiol glycone, or the oleanolic acid if it is triterpene saponin, and those are all the glycone moieties of steroidal saponin moiety. And also the attached sugar will be separated upon hydrolysis. The hydrolysis is very easy, a reaction that happen after the oral administration of ginsenoside or banaxoside by the effect of stomach acid or intestinal enzymes. Other compounds present in ginseng, such as polysaccharides or glycans, named as panaxanes and quinquefolanes, ABC. Also the polyacetylenic alcohol, named as banaxinol or banaxidiol. This is a very important compound, and it's responsible for the anti-tumor effect of ginseng, as we will see later on the uses. It contains acetylenic groups, C triple bond C, and this is not very common in the natural compound, so it's very characteristic for ginseng and also responsible for an important activity. It also contains essential oil. One of the most important ginseng herbal supplement should be standardized for its ginsenoside amount, and this standardized ginseng extract is known in commerce or in pharmaceutical market as G115. So G115 is an abbreviation for standardized ginseng extract. It's a natural product from genuine Panax ginseng. Standardized means that each dosage unit should contain accurately determined and equal quantity of ginsenosides. Chemical test for ginseng root or powder. The powder plus iodine give a blue color due to the presence of starch, and this is apparently true for the white ginseng especially, because the starch here is not gelatinized. The powder plus sulfuric acid give us brick red color, then turn it to violet due to its triterpenoid content. Uses. There are several uses for ginseng, and these are some of the most important uses for ginseng root. The first use is adaptogen. Due to the presence of ginsenoside, adaptogen mean enhancement of body non-specific resistance to external stress, physical, chemical, or biological stresses. Adaptogen mean that it restores the normal level of hormones of blood parameters inside the body. So if some hormone are elevated, it decreases them to the normal level, and if others are decreased, it increase them to reach the normal level. Also it reset the body glucose level, blood pressure, body temperature, and everything is resetted or restored to the normal non-pathological level due to ginsenosides. Also, ginseng is used to boost energy and used as tonic and stimulant. In the short term use, it improves concentration, healing process, and stress, and work efficiently in healthy persons. You can see in some marketed coffee product. For example, here in Egypt we have a brand of coffee known as Ali Coffee. They merge between coffee and ginseng extract to increase the tonic and stimulant effect of coffee. They add ginseng to improve also concentration, and this is very effective with coffee. The long-term use, it used to improve well-being in deliberated degenerative conditions in old age geriatric person. This activity is due to ginsenosides. For nervous system or CNS, central nervous system problems, ginseng is an agent capable of improving memory and intellectual skills, treatment of conditions such as normal aging, cerebral vascular diseases in aged senile dementia, mental function impairment, and Alzheimer's disease. There are several mechanisms of action were responsible for such great activity of ginseng. For example, it protects from neural degeneration. It used for preservation of the antioxidant level due to its powerful antioxidant effect. It used also to inhibit the formation of malonaldehyde, which is a chemical used for predicting the incidence of Alzheimer in some patients. Also because of its adaptogenic properties due to the ginsenoside, especially RG1 and RB1, it suppress and stimulate the CNS respectively. That means RB1 suppress some parameters in the central nervous system to restore its normal function, and RG1 stimulates the other inhibited parameters, so it make reset for the central nervous system. Polysaccharides as well ameliorate the neuroprotection through regulation of immune system and reducing the oxidative stress. So in the market we find a lot or several supplements including ginseng extract together with ginkgo extract, ginkgo biloba leaves and ginseng root together, and several supplements as you can see here. These are examples for the treatment or improvement of Alzheimer patients and also for dementia patients. Ginseng also is commercially marketed for treatment of sexual dysfunction. Panax ginseng orally improves sexual function in adults with erectile dysfunction. It improves also the sexual arousal and satisfaction in postmenopausal adults for women, and sexual desire in female who reported sexual problems. And we can see some products here available in the worldwide market for improvement of sexual problems in male and female, especially in male. This is you can see here, for example, red ginseng for male sexual enhancement, or tonifiant sexual. And also this product is available since long time in the Egyptian market for treatment of sexual problems, especially in male, and to boost the energy level. It contains ginseng root as well as royal wheat in capsules. Ginseng also is reported for its hypoglycemic activity. It is used in non-insulin dependent diabetes or type 2 diabetes due to effect of saponins and polysaccharides. There are several other important uses for ginseng, such as its anti-tumor or cytotoxic activity due to the presence of polysaccharide and polyacetylens. Immunomodulator due to polysaccharide is very important natural treatment to boost the immune system to fight infectious diseases. You can see here, for example, this product is called ginseng immunity for enhancement of immune system, containing ginseng root. It's also used to normalize blood pressure. This is due to its adaptogenic effect. Both high and low blood pressure are restored to the normal level. As a liver protective agent in alcohol intoxication therapy, for withdrawal problems of nicotine, morphine, cocaine, and amphetamine, as we previously discussed in the uses of ginseng root. It's used as a tonic or stimulant, so it could help effectively in the treatment of withdrawal symptoms of nicotine, morphine, and other drugs. We could even prescribe it for persons who try to stop smoking. Also, it has a topical effect in topical preparation for skin diseases such as acne and eczema, and for nail and hair disorders. So after the great uses of ginseng, how could I use it, and in what dose? If I will use the powdered root, I can use from 0.5 to 1 gram daily. If you are going to use the ginseng extract, standardized even in capsules or in liquid formula, if it's capsules, you can use up to 200 milligram daily, divided into two uses, into two doses. one in the morning 2 hours before food, and one in the evening at least 2 hours after food. It has also been recommended that ginseng shouldn't be taken continuously for periods exceeding 3 months. Ginseng treatment can be continuous in the aged and chronically sick patients only, and also it should be under medical supervision. Why ginseng shouldn't be taken for a long period? Because if it's used for long period, the probability of incidence of side effects, as we will see in the next slide, will be high. The side or adverse effect of using ginseng in high doses or for a long period include: the first or common side effect is trouble sleeping. It stimulates the whole body and boosts energy, so may result in sleep troubles or insomnia. Also, the ginseng abuse syndrome. It's defined as hypertension together with nervousness, sleeplessness, skin eruptions, and morning diarrhea. And when ginseng is stopped from usage, other symptoms appear, such as our abrupt withdrawal resulted in hypertension, weakness, and tremors. Other side effects for long-term use or high dose of ginseng, such as heart stroke. Prolonged daily use, especially of the Siberian ginseng in combination with caffeine and vigorous exercise, was responsible for heart strokes in some patients. And if it used topically in high dose, it could result in skin irritation and sometimes in burning. Contraindications. The ginseng should be contraindicated in the following cases: in pregnancy and breastfeeding. We don't have enough reliable information about the safety of ginseng in pregnancy or breastfeeding, so it should be avoided in those cases, or if it's a must to use it, it should be under medical supervision. Also in children, Panax ginseng is likely unsafe in infant and children. Panax ginseng has been linked to fatal poisoning in newborns. It is not clear if it's safe in older children or not, so should be used only under medical supervision. Ginseng is also not suitable for patients with autoimmune diseases such as multiple sclerosis, lupus, or rheumatoid arthritis or other conditions, because it's improve or activate the immune system, which make and activation of immune system will worsen these conditions. Also, Panax ginseng or ginseng is not suitable for patients with suppressed immune system, like patients who make an organ transplantation and use corticosteroid to suppress their immune system. So it is not suitable to use immune stimulant drugs such as ginseng in such patients because of the risk of organ transplantation failure. Also, ginseng is not recommended for patients with bleeding disorders because it interferes with the blood clotting. In patients with heart disease, because after long-term use of ginseng, it can affect the heart rhythm and the blood pressure, so it should be used in caution with patients with heart conditions. Additionally, hormone-sensitive conditions such as breast cancer, uterine cancer, ovarian cancer, endometriosis, and uterine fibroids. Ginsenoside have a phytoestrogen phytoestrogen effect, which mean it resembles the estrogen in its action inside the body, so it may worsen those conditions. Also, patients who have insomnia or sleeping problems shouldn't use ginseng at high doses, because if it used in high doses or for long time, it may worsen the insomnia in those patients. And finally, it's contraindicated in patients with schizophrenia. High doses of ginseng have been linked with sleep problem and agitation in people with schizophrenia. Drug interaction. Ginseng is contraindicated to co-administer with the following drugs: with caffeine, especially the Siberian ginseng. As we told previously, it increases the risk of heart stroke. with insulin and anti-diabetic drugs because the risk of hypoglycemia. Both the drug and ginseng will decrease the blood sugar level and cause the risk of hypoglycemia. With immunosuppressant drug because the ginseng counteract their effect. The ginseng is immunostimulant and will work in opposite way to the activity of those drugs. With anticoagulant or antiplatelet drugs such as warfarin, Panax might slow blood clotting and this could result in increased risk of bleeding. With estrogen also, ginseng decrease its effect because it's a phytoestrogen and will compete with the estrogen about the receptors, so it decreases the effect of estrogen. Also, ginseng is contraindicated to administer with medication changed by liver cytochrome B450 enzymes because ginseng affecting these liver enzyme. Examples of the product eliminated by cytochrome B450 enzymes is the antidepressant and also the antifungal drugs. So ginseng couldn't be administered with these drugs because of potential drug-drug interaction or drug-herb interaction. Products in market. These are some examples of ginseng products in the Egyptian market. Some products contain the entire powdered roots such as intenin for the red Korean ginseng, and other contain extract either in tablets such as this product or in capsules such as all those products. And also there are liquid formula may be available for kids such as this one. Also there are several more and more products of ginseng either in the Egyptian market or the worldwide market. I hope this lecture was useful for you, and if you have a question please write it down under this lecture. Thank you.